At your initial clinic visit, we will discuss the issues that are going on with your hip or your knee. We will discuss any treatments that you've had previously. We will also discuss any other health issues that may be going on at the same time. From here, we will review your physical exam and your x-rays and come up with the best plan of action for you. This could include surgery, or this could include other treatment modalities that we will try prior to surgery, and we will discuss all of these in great detail. We will also discuss the next steps, including surgical planning, other preoperative clinic appointments, expectations after surgery, and what to expect in the postoperative period. Questions will be answered, and if you do get a surgery date, you will be provided with more information after that. The next steps after that initial clinic appointment for someone that is undergoing surgery often involves laboratory work on that same day of your first clinic appointment. I will review that lab work afterwards and will often make a determination whether there's something else that we must address prior to surgery. From here, we have a preoperative optimization clinic that is run by some of our advanced practicing providers that we will send you to for preoperative clearance for surgery. This clinic is very important because as much as we can do to decrease the risk after surgery by working before surgery can help make your joint replacement go as smoothly as possible. The purpose of this clinic is to review your medical records, your laboratory work, and coordinate with your other providers to make sure that you're as healthy as possible before surgery. The next steps in the process after this preoperative optimization clinic will be to prepare your home and your family for surgery. This often will involve arranging help for 1 to 2 weeks after surgery at home, especially for people that live alone. You will be provided with some easy therapy exercises that you can start to perform at home. The stronger that the legs are before surgery and the better the range of motion of the knee is before a knee replacement specifically, the easier and the better the outcome will be postoperatively. It is also time to begin to prepare the home for surgery itself. This will often involve preparing easy meals for the week after surgery, putting commonly used things in convenient places, arranging help for children and pets, as well as simple household care, making sure that there's a clear path to walk throughout the house, especially with a walker or a cane, and removing any tripping hazards such as loose rugs, cords, or wires in the home. The final clinic visit prior to surgery will be the anesthesia pre-op clinic visit. This is a very important clinic visit to be evaluated by our anesthesia department to determine that there are any other medical issues that could preclude the use of certain anesthetic agents or certain anesthetic techniques. This is also the time for you to discuss your other medical issues, comorbidities, and any issues you've had previously with anesthesia. They will also help to provide education on when to stop certain medications prior to surgery, especially blood thinners, as this could make a difference in the timing of your surgery. You will receive some information about skin and nasal preparation to decrease the risk of infection after your surgery as well. On the day before surgery, and this is the business day before surgery, so for a Monday surgery, it would be the Friday before, you should expect a phone call from our surgery schedulers to let you know what time and where to arrive in preparation for your surgery. In regards to the night before surgery, in general, do not eat anything after midnight. You may have clear liquids up to 2 hours before your arrival time the morning of surgery, and make sure that you do not include coffee in this, as coffee is not technically a clear liquid by our definition. On the morning of surgery, it is important to arrive on time. Once you arrive to the hospital, you will go to the first floor admitting/registration desk. After you sign in there, you will be sent to the second floor same-day surgery area where you will wait and be called back to a room to prepare you for surgery.